2017. Now, do you know that the word meditation and medicines come from the same roots? Meditation is a kind of medicine. Its use is not only for the time being. Once you have learned the quality, then you need to have any particular medicine. Therefore, I would like to invite today's keynote speaker, Professor Michio Nomura, sir. He is an associate professor at Kyoto University, Japan.
I'm delighted to introduce him with his research area in certain fields like genetic and socio-environmental mechanism for brain imaging like fMRI and NIRS. Today's main theme of the current session will be different functional connectivity of the brain play a crucial role during focused attention and open monitoring meditation. So please welcome Nomura sir with a huge round of ovation. Please give him a big hand.
Good morning. Good morning. Okay. Thank you very much for your kind introduction. And I'm impressed by your hospitality, Professor Manish, and organizers, and students, and all audiences. So thank you very much. So could you show my slide here? No. It's okay? Okay. Okay, let me ask you, how many of you have experienced meditation? So please raise your hand. How many of you have experienced meditation? Not so many. So are you really Indian? Are you really Indian? Okay. So I have to confess, I'm not a super expert for meditation. But as a psychologist and a neuroscientist, I am going to show you what is meditation like and how it works in scientific point of view today. Okay? So today, I focus on meditation, mindfulness meditation. So first, I'm going to show you the trend of mindfulness. And in the middle of my talk, I'm planning to have you experience meditation today. Okay? And the term meditation is derived from Pali language sati, meaning the remember. And mindfulness has been defined in many ways. There are no certain definition, but one of the pioneers of this research field, John Kabat-Zinn at University of Massachusetts, describes it as non-judgmental attention to and awareness of present moments and events. Okay? So what's the awareness? So awareness refers to a consciousness of internal and external experience, right? And attention is the processes of the consciousness of internal or external experiences, all right? So here you can see the organs like ears and eye and stomachs and so on. And if some stimuli input to your organ, your consciousness arises. And within some part of your consciousness, you can be aware of it. So therefore, you can pay attention to it, okay? But it's difficult to keep your attention to it because some thoughts and feelings come with your sensation, right? So we are caught by them, and the mind starts wandering. So equanimity becomes important. Equanimity means a non-judgmental style, non-reactive tendency toward all experiences. With this equanimity, we are able to be mindful. Then, how we can achieve the state of mindfulness? So there are some useful techniques. For example, Vipassana meditation and Tibetan meditation and Zen meditation, that all stem from the primitive Buddhist meditation that Buddha did when he enlightened. Based on these three techniques, mindfulness-based stress reduction, or MBSR, and mindfulness-based cognitive therapy, MBCT, were developed as psychotherapy. And in my talk today, I use the term mindfulness as state and trait, and mindfulness meditation as Vipassana, Tibetan, and Zen meditation, and mindfulness meditation as MBSR, MBCT, okay? So move on to the next topic. So recent years, mindfulness meditation has a lot about attraction, attention. For example, mindfulness was featured in Time magazine in 2014, and I hope also in Biyani Times in recent years, in near future, I hope so. And Weird magazine and Scientific American magazine published by Nature Publishing Group in 2014, and so on. So like these, a lot of famous magazines have featured mindfulness. And you can see here the British Parliament have also discussed utilizing method of mindfulness meditation. And also in UK schools, they decided to analyze this effectiveness of mindfulness or mental resilience of teenagers. And in the business world, it's the World Economic Forum held in Davos in 2013. People say pay attention to mindfulness to increase profit by making you a better and more effective leader. Actually, like you see here, a lot of companies have adopted mindfulness training in some form into workplace for the stress management. And also in Japan, mindfulness training developed by Google company have started since 2015. And it's surprising that all juvenile training schools in Japan have started mindfulness training, by which traumatic experience of girls. So most of the girls in juvenile training school have suffered from sexual abuse or PTSD and so on, are attenuated by simply inviting themselves to interface with moment in full awareness. So let me move on to the next topic, trends of scientific research. So this figure shows how the number of mindfulness research increased. The orange line is mindfulness, and the blue one is meditation, and the green one is the neuroscience-related articles. So as you can see here, the mindfulness research, orange one, okay, have increased rapidly after 2000. And back in 1992, John Kabat-Zinn, who is the founder of mindfulness intervention, firstly showed its efficacy for stress reduction, okay? So then in 2002, Tisdale at University of Cambridge published the research in terms of cognitive therapy for depressive patients. So I think these papers triggered the rapid increase of mindfulness researches. How do you think about it? So this is a study done by Kabat-Zinn, and y-axis here, yeah. Y-axis here is an anxiety or depressive scores for each scales. Hamilton and Beck, they are very, very famous questionnaire to measure emotional disorders. And you can see after MBSR treatment, symptoms of anxiety and depression significantly decreased, like you see here. And importantly, this effect maintained during the 3-month follow-up period. And this figure showed so-called survival curves of relapse in depression. The y-axis is non-relapse ratio, and over a 24-month follow-up period, MBCT reduces relapse in depression on the same level with antidepressant. Okay? So it's surprising that mindfulness therapy works like antidepressant drugs, almost same function they have. And you see here, mindfulness interventions have various benefits. So not only reduce symptoms like stress, depression, anxiety disorder, and chronic pain, and PTSD, and binge drinking, but also increase immune function, subjective well-being, and cognitive functions as well. Okay? Okay, so now, I guess you can't wait for meditation, right? You are eager to do meditation, or you are dying to do meditation right now. So, I would like you to experience 2 forms of meditation. The first, focus attention. So it's very, very simple. Just focus on your breath, okay? So please let yourself relax. I would like you to do this focus attention meditation right now, right here, okay? Let yourself relax. And seated on a chair with your back upright. And breathe naturally. Your hands resting. And let your eyes closed. Let your eyes close, please. And let's meditate for about 5 minutes. Just feel your body. Just feel your breathing. You may feel hot, cold, pressure, vibrating, or some other things. Now, as you do this, you notice that your mind starts to wander. Start thinking about other things. This is not a problem. It's very, very natural. Just notice that your mind has wandered. You can say thinking or watching in your head softly. Then bring it back to your breath. Just keep focused on your breath. If your attention wandered, maybe anxiety, or planning, daydreaming, fear, it's not a problem. Just bring your attention back to your breath. Thank you. So let me ask you, does anybody keep your attention to breathe throughout this time? Please leave your hand. If you could keep your attention to your breath throughout this time, please raise your hand. Nobody here, nobody here. Okay, so it's very, very difficult, right? So let me explain a little bit more about focused attention meditation in detail. So the right green circle represents awareness, okay? It's awareness. Then we set some object for paying attention to as an anchor, like a breath. Here. And sometimes you can focus on the flame of a candle or the image of a god, as you see here, like here, as you like. And because of this anchor, even if some thoughts and feelings comes up, you are able to stay focused on it. So you are able to stay focused easily and be aware of the sensations, then detach from distractors like this. So next, I would like you to open your focus from narrowing to broader. So this time, just notice your body from inside. So let yourself relax with your back upright, breathe naturally, then please close your eyes. This time, I would like you to open your focus from narrowing to broader. Just focus on your body from inside. So please keep your back upright, the hands resting, and breathe naturally, and let your eyes close. We stay with this for some time. So from the inside, noticing the shape of your body, the weight, touch, and let yourself relaxed and become curious about your body. If you feel anxiety, daydreaming, planning, or whatever, just observing them with equanimity. It does not matter your attention wandering. Because emotion is like a weather. Emotions comes and go. Just let them go. If you get on a train of wandering, just get off. If you are in the bad weather, bad crowds, just stay in the blue sky. Okay, thank you. So let me explain you about this in detail again. So instead of setting some anchor, like breathe, this time you just observe all sensation from your body. It's more difficult to keep detaching consciousness from distractors, right? Because there are no anchors this time. So when distractors comes, detach from it with equanimity. So it's very easy to say, but it's difficult to do. So I would like you to just practice again and again. Like a weight training on your muscle. Just practice. So next, I'm going to show you some neuroscience research in terms of meditation. And this is fMRI, or functional magnetic resonance imaging in Kyoto University. So we put participants into this scanner and ask them to meditate so that we can measure brain activity during meditation by using this equipment. Then question arises, so what is the brain areas that underlying FA and OM? Different form of meditation would be achieved by different brain mechanisms, I think. And how brain networks changes according to practicing this meditation, okay? So here's a good example for FA. So you experience during FA, maybe you can remember that first you sustain your focus on your breath, and when mind wanders, then you are aware of it, and shifting your attention back to the breath, right? And so there are 4 processes. And this experiment is very, very smart and very exciting. So I hope you to develop this kind of experiment in the near future, hopefully in Kyoto University. And here, just by asking participants to press the button whenever their mind wanders, and then you can identify brain region which corresponds to these 4 processes during FA. So like, you see here, salience network and executive networks and default mode networks. I will not get into the detail today, but these kind of the brain networks underlying for each process of focused attention meditation, okay? And this is the preliminary data we got recently, showing that as you practice open monitoring meditation, brain connectivity changes, right? Like y-axis is the functional cognitive change between the prefrontal region and subcortical region, and x-axis represents the total meditation practice hours. And you see here, as you practice meditation, this connectivity decreases. And these areas are said to be involved in memory processes, so which means that relative to beginners, experienced meditators may be more free from their autobiographical memory. In other words, as you practice OM meditation, it's easier for you to fully commit it at the present moment. This is evidence for that. And our idea is supported by some other studies. So this is a study done by other researchers. And if you train participants with no prior meditation experiences in a program for 8 weeks, your brain gray matter volume density in left hippocampus, which are involved in learning and memory, increase like this. So you can see here, hippocampus. Hippocampus is a core region for memory processing and autobiographical memory of your memory. Like this, the volume of these areas significantly increased after 8 weeks program of mindfulness meditation. So it's very dramatic changes, I think. And also this kind of changes were seen in postcingulate cortex and temporal parietal cortex. This area are thought to be involved in emotional regulation, and temporal parietal junction are involved in self-referential processing. So you are free from your mind wandering. Well, so in conclusion, this is a take-home message for you. So first, mindfulness meditation may not only reducing negative symptoms like depression and anxiety, or PTSD and so on, but also increase cognitive function and subjective well-being. And such benefits are accomplished by changes in the brain networks and structure, possibly reflecting strength, present moment awareness, right? And today I don't have much time to talk about this, but there are some evidence showing that mindfulness meditation affects gene expression. So mindfulness training may also reverse stress-related changes in gene, specifically in inflammatory responses. So I would like to close my talk by saying the words of Shu Suzuki. He's the Zen monk and teacher. We should not attach to some fancy ideas or some beautiful things. We should not seek something good, because the truth is always near at your hand, within your reach, and within your brain. Thank you for your attention.
Thank you very much, sir. It was very informative session about focused attention meditation and open monitoring meditation along with the neural importance. If any query from any of the student side or from any of our dignitaries, they may ask, sir. Can we please pass the mic? Any queries, please?
Good morning, sir. Importance of open monitoring meditation for brain activity of student during examination days.
Could you say again, please?
Sir, what is the importance of open monitoring meditation for the students' brain activity during the examination days?
During examination days?
Yes, sir.
Okay. So by doing the open monitoring meditation, you are more easily to focus your attention to learning, right? So it might work during your preparing for your paper exam or something like that. I guess so. Is it the right answer to you? No?
Yes, sir. Thank you, sir.
Thank you.
Any other query? No?
So I saw you, some of you during meditation were about to fall asleep, right? So during meditation, we are easy to get asleep. But it's good for you because you are being relaxed, right? Okay. Yeah.
The response against how the time versus. So whether the response becomes saturated after some time, or what do you think? If we look at the scale versus time of MBSR.
Basically, MBSR treatment works for the short time is just 10 days. So you are doing the mindfulness-based reaction, mindfulness-based cognitive therapy, just 10 days work, I think. But you have to do it for 8 hours for each day, I think. It's very hard, but it works. Maybe. I should say maybe, because some of you, meditation does not work for you. So I'm just planning to see the condition meditation works for depending on each person and depending on the social context or something like that. This is a task we should clarify in the near future, I think.
And I guess it must be reflecting by the age of group peoples. At different age, if you do such MBSR.
Oh, yes. It's a very important question. And basically, MBSR works to all ages. All ages, I think. And especially for young people like you, MBSR will work because your brain is in a very moment of neuroplasticity, right? It works well, I think.
So, what are the? I mean, it's okay. What are the limitations of this study?
Limitations. So, yeah, very critical point, I think. So, limitation of this study is this kind of effect is just the average of the effectiveness. So, as I told you, there are some person who does not get efficacy of meditation. So, this is a limitation. So, we should clarify the people and condition who does not work in meditation. This is a limitation. Thank you.
Okay, so I think you have time to interact in the lunch break or coffee break. And let's thanks again Professor Nomura for sharing the neuroscience and the relevance with the meditation. Thank you very much.